I'd like to share with you a really phenomenal patient experience that I had. This is a woman who 20 years ago had her uterus and ovaries removed for a gynecological malignancy, and she thought she was cured. She was having some pain in her upper abdomen and had a CAT scan that showed a tumor on her liver about the size of an avocado. She had imaging workup to determine if that had spread anywhere else, and that was the only spot. So she went to Boston to get an opinion as to how to deal with this tumor. First off, they said, well, you should biopsy it. So being a Cape Cod Hospital patient, I did a biopsy of her tumor. And then while I saw her, I said, well, if they're thinking about treating this tumor, I have a technique called image-guided tumor ablation where I think I can ablate this tumor on your liver. So she listened intently, and she went to Brigham and Women's Hospital, and they discussed her at a tumor board. And the surgeon, who's a liver surgeon, looked at the case and said, you know, this probably would be better treated at Cape Cod Hospital with Dr. Dupuis, who does ablation. So I treated her, and her tumor was large, so it kept coming back near the margins. And that's one of the nice things about image-guided tumor ablation is I can repeat it. But I don't know the margins like a surgeon. When a surgeon cuts out a piece of liver and gives it to the pathologist, and they look at the margins and they say, oh, you've got clear margins. I'm using imaging. So I think I have a margin, but I really don't know until I follow that patient. One of the beauties is that I can see exactly what I've done with imaging. So I follow my patients very closely. And Cindy has been a real trooper, and she did not want systemic chemotherapy, which apparently doesn't work real well with her tumor, but they were willing to give her if she decided not to go with my procedure. Well, lo and behold, I was able to control her tumor completely, and she's tumor-free without ever receiving systemic chemotherapy. So she's very happy, and I'm very happy for her.